This is for the patient receiving therapeutic services. So what this is telling us that the patients that come in for the therapeutic services, you're going to sequence first the diagnosis or the problem or the reason for the encounter. And again, these chronic conditions can be sequenced as additional diagnoses, but keep in mind, only if it meets the guideline for chronic conditions that we just went over. The only exception to this rule for therapeutic services is when the primary reason is for chemo and radiation. And that's your chapter-specific guidelines. Because chemo and radiation, there is a Z code for chemo and there is a Z code for radiation. So those codes would be listed first. Remember, chapter-specific guidelines take precedence over Section 4 outpatient guidelines. An example here, the patient had a phlebotomy for polycythemia vera. You're going to code the diagnosis because we have that confirmed. Okay.
Yes, I have a question.
Yes.
Yeah, concerning where you have the symptoms code, the codes, the R codes.
Yes.
So does it mean that symptoms are only placed on the R codes? We can't find symptom codes outside the R codes?
We would code symptoms if we don't have a definitive diagnosis. And those symptoms are in our R code categories.
Okay. So that means we can't find any symptoms outside the R code.
Can you give me an example, Bledson? Can you think of something?
Like just think of maybe a symptom being outside an R code, maybe like in A code or B codes.
Okay.
So all the symptoms are placed under R codes. We can't find other symptoms outside there.
Okay. So if you have, let's say you have sepsis, because that's like an A code. And with sepsis comes a lot of symptoms. You're not going to code those symptoms.
Okay.
Does that make sense? Is that what you're asking me?
No, I know that symptoms codes are in the R codes.
Yes.
Like R is for symptoms. So I was asking, like, is it possible to have other symptoms code outside R codes?
Symptoms outside of our codes.
Yes.
Okay. Okay. You could have symptoms outside of our codes. So you want to be careful that you identify that as a symptom. I know that in the N category in urinary, there are some specific diagnoses that fall into the N chapter, I believe, that you, if they are a symptom of a specific diagnosis that's documented, then you're not going to assign those unless at your specific diagnosis, there are instructional notes that tell you to code like stress incontinence, such as those. So you may have instructional notes that tell you to code symptoms, and those symptoms are not in the R category. So yes, there may be symptoms in other categories.
Okay, thank you.
You're welcome.